Hello, everybody. This is Gary. Today is October 1st, 2021. It is 4:55 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. I'm doing pretty good today. I saw my psychiatrist yesterday. We talked about a few things. One of the things we talked about was my taking Klonopin, which is a benzodiazepine tranquilizer. It does have the potential for being physically and mentally addictive, and we're watching that very closely. But we did agree to give me the option of taking 1 milligram of Klonopin a day as opposed to just half a milligram, because I, like a lot of people, am under a lot of stress. There's a lot of weird things going in our world, especially in politics and the news, which I told my psychiatrist I think I'm watching too much of because it's aggravating me. I get too involved in politics, I get too involved in watching the news, and then I get myself upset and angry and frustrated, which aggravates my hallucinations, my paranoia, my depression, and my anxiety. But as far as the Klonopin, I have the option of taking 1 milligram of Klonopin a day, but I'm not required to take 1 milligram of Klonopin a day. I could take no Klonopin if I don't need it. Klonopin is there as a tool to deal with my really severe anxiety, and I take it with my Zyprexa. It helps with the hallucinations and paranoia and the delusions. I mean, the Zyprexa does. Klonopin is for anxiety. The Zyprexa is for psychotic episode symptoms, like paranoia and hallucinations. But taken together, they're very effective in controlling my agitation, my paranoia, my anxiety, my delusions, my hallucinations. So I did take half a milligram of Klonopin this morning with my Zyprexa. I didn't get much sleep last night, and I got up early to go to the pharmacy to get the Klonopin. I didn't want to have to go to the psychiatric emergency room, so I took half a milligram of Klonopin. I probably won't take another half a milligram today. I really don't need it. I feel fine now, less agitated, less anxiety-ridden, less paranoid. Hallucinations are at a minimum. And as far as my hallucinations are concerned, my hallucinations are restricted to auditory hallucinations. That is, I hear voices, often telling me that people are following me or are trying to hurt me in some manner. And that goes hands in glove with my paranoid delusions. But that's all under control for now. Um, One of the other things that me and my psychiatrist talked about was the fact that I need to start seeing a therapist. What's the difference between a psychotherapist and a psychiatrist? A psychiatrist is an MD, a medical doctor with a medical degree who prescribes medications. That is the role of my psychiatrist, to discuss my medications and what dosages and side effects and all that. A psychotherapist is simply somebody you talk to deal with personal problems. They don't prescribe the medication, they're there as talk therapy. And so I've agreed to meet with the psychotherapist on a regular basis in exchange for raising my Klonopin. Like I said, Klonopin, like Ativan and Valium and Librium and Xanax, can all be physically addictive, and we're keeping an eye on that. And my seeing a psychotherapist might help reduce my anxiety and use the Klonopin actually less often than I've been using it. So I've agreed to see a psychotherapist on a regular basis. I have an appointment next week with a new therapist. I did insist that I wanted a female therapist as opposed to a male psychotherapist. I just get along better with female therapists that I've had in the past than I did with male therapists. Now, my psychiatrist is male, But over the past year and a half, I've got to know him pretty well. He's a pretty cool guy, easy to talk to. Have no real problems with him. We don't talk so much about my personal issues as we do medications and the side effects and the effectiveness of my medications, dosages, that kind of thing. Um, Talking to a psychotherapist is more about talking about much deeper personal issues in a very private setting. Psychotherapists are required to keep confidentiality, unless, of course, they think that somebody is about to hurt themselves or break the law in some fashion in a violent way or something. They're not obligated to keep confidentiality under those conditions. But generally, a psychotherapist and a psychiatrist um, is um, obligated to keep confidentiality unless somebody else is in danger, obviously. So I've agreed to start seeing a psychotherapist and talk about my personal issues with them on a regular basis. Maybe weekly, maybe once every 2 weeks. I'm not sure what the schedule is going to be. But I think it might be a good idea for me to start seeing a psychotherapist. It might keep me out of the psychiatric emergency room by reducing my anxiety levels, help me deal better with my psychotic episodes and my psychotic symptoms. And when I say psychotic, I mean those symptoms that detach me from reality, like hearing voices that nobody else can hear, having paranoid delusions that people are following me when they're not following me. Those kinds of things are breaking away from reality and creating my own psychotic reality. That's what the word psychosis means. A break from reality um, in the form of delusions or hallucinations, usually. Um, Depression can sometimes be psychotic. It can be so severe that it can become psychotic. Anxiety generally is not a psychotic symptom. That's why Clonopin helps with anxiety, but doesn't help with psychotic symptoms, generally speaking. Um, so I'm doing pretty well today. Haven't got much to complain about. Not much else really to talk about. See my psychiatrist on November 11th, and today's the 1st of October. And my psychiatrist is going to be out for a while, a week or two, I think. He's got some exams that he has to take as a medical doctor. Because a psychiatrist is a medical doctor, they have a medical degree, that's why they can prescribe medications. He has some exams that he has to take related to his career. And also his anniversary is coming up, his marriage anniversary, so he's taking time off for that as well. As for me, October is a big month. My birthday is October 15th. I was born October 15th, 1965. I'll be 56 years old. So my birthday is in about 2 weeks. And that's about it for now. Like, share, subscribe, comment, and press the notification bell so you know when I put out new videos. And if you want me to do a video on a specific topic, let me know in the comment section.